A place of employment where somebody is in a hospital gown. So we have gowns here, don't we?
Mm-hmm.
Yeah.
Oh, that's fast. It's okay, we can understand that.
We were all in gowns yesterday.
Oh yeah, they were all. Yeah. Oh, they were rubbing yesterday. Is everybody relaxed?
So my job is to do range of motion to him. So he comes in, he's laying in a bed. Well, now you guys can in your mind say he's in the inpatient rehab. Inpatient rehab would be someplace like Health South. It'd be like John Knox with the rehab center. Or he's in a skilled nursing facility, or he's in a hospital. But he's not in a home health setting and he's not in an outpatient setting. Those are two exclusive areas. So he's in one of those three settings. And I want to do range of motion to his to his legs. So if he's in a hospital gown, I'm going to have him like this. So this leg's covered. His private area is covered. Some people will even do this. They'll even sort of wrap it like this, which is a lot of massage therapists will tend to make a little drape or a little sling like this, and then you keep the body covered. So now I've just exposed the area that I'm going to work with. Okay, so from here, it's basic range of motion. So you guys feel okay with range of motion with that? Draping is this way. How would you add anything?
No, I would do it. Just know that when you come in, a lot of them, they don't care in the acute setting. They don't have anything on under. You're gonna see. So some women, depending if you're a male walking in, like me and Mike went in, and she just started freaking out because everything was out. You want to make sure that at all times you try and keep the sheet over them, try and adjust their gown so it can be as long. And you would do it the same way, just kind of tuck it in to cover whatever you can, and use what you can to protect their modesty.
Correct. So
even if it doesn't bother them.
Right. So if I didn't do this here, if I had Kyle and I had him just like this, and I peeled this back like that. So when I did his range, everything down here is exposed. So now his daughter is sitting here visiting him, and she sees some things, and so it's not always good that family members see that. And also in patients' rooms, the door is open. If you're in the ICU, they have glass doors, and sometimes you don't always close the curtain. So people like Colleen and I, workers, are walking through and you see someone's goods, so you want to really keep it covered. So this wouldn't work because this is going to expose too much. All right. So the idea of draping is for modesty, for comfort, for cultural reasons, for cleanliness. Okay, things like that. All right. Rarely am I going to do this and keep both legs open, because now I have an open area. Now if he has underwear on, if it's a guy, some men and some women in the hospital setting can put underwear on. Their spouse will bring them underwear. Now it's different. Now if you do the range of motion, you're not exposing the genitals, you're exposing the groin, but it's covered. So it's a different. Okay, you guys follow it? For the upper body,
just something for the out. A lot of you going to outpatient, you will have ladies come in for therapy in dresses. They didn't bring anything else. So, and they'll be like, no, I'm fine. If you can't get them behind a drape, cover as much as you can, because that can come back on you no matter what. So just if you see a lady coming with her dress, and then for the guys, make sure you tell them what you're doing, so that they don't think that you tell them, I'm draping you for modesty. I still do that even when our patients, I don't know if they understand me or not.
Yep.
That way you're communicating it and you've said it.
Yeah. And upper extremity, same thing. If I'm going to work with Kyle's right arm, I may cover the other part of his body. So now I have his right arm here, and I can go ahead. I can do my range of motion. I can do whatever I'm going to do. Okay, so and then now I'm done here, cover that back up, and I might have to walk around to the other side of the bed, and then do this side. So draping is just exposing the area that you're working with. You guys follow some of that? And I can't think of any other.
No, it's really easy, but it's just sometimes people forget. I mean, it's just about throwing the sheet down so that nothing's exposed. It's not that difficult.
Yeah. Okay. Gabe, can you get me a towel? Oh, that towel right there.
I have a question.
Yes, Laura.
When I did
No, I'm good, Gabe. I'm good. Go, there you go.
When I did my observation in acute care, there was a man who was a really bigger man, and he was off the side, and they had him doing like this.
He was sitting or laying?
Sitting.
He was sitting. Go
But
ahead,
you
sit
saw,
up. Go ahead, sit
I
up.
mean, like his whole back. And
Okay.
is there a way to drape that could you put something like around him, like?
So you saw his whole back here
Yeah.
in his butt.
Uh-huh.
Yeah. So basically, and he had a gown on.
Mm-hmm.
So yeah, so it'd be a double drape basically. So yeah, you would either, because again the hospital gowns open up in the back, so they're covered here, so you don't see the chest. I can either cover him up. I can cover him up here, and now he can do. Go ahead. He can do extensions here. I know, I'm getting it. So I could do exercises here. Okay. So at this point, I don't see his back. Nobody can see his back. The wall in the room is there, but it's open. It's exposed.
Close the doorway there.
Okay, well, so then
Okay.
you can either close a curtain or whatever,
Uh-huh.
or you take another gown and you
Wrap
put
around.
the gown on the other way and you tie it in front so it covers up the back. So you can put it. They call it Superman cape. Put it on, tie it up, or you can just do.
Drape it around the back.
You just cover it up like that so it doesn't expose, and usually a sheet's long enough to cover everything, and then you do your treatment. Okay, but most patients aren't concerned with having the back and butt covered in the bed. They're more concerned when they get up and they have to walk in the hallway, and now you're going to see some stuff. Okay. You guys okay with that? All right. So Brenda, come on over. For Colleen, you want to drape Brenda for?
Oh, I thought you just wanted pressure for her.
But do what?
Pressure.
Oh, you want to do it? For, no.
Drape.
I would rather pressure Kyle. So I'd rather you pressure drape her for pressure. So I'm using her hip and low back.
Oh, okay,
for-
got it.
yeah.
Okay.
So if you have a way that you want to drape. For
No,
pressure,
we were just gonna show pressure release techniques.
Oh, okay, okay,
While
fine,
they're in bed,
yeah.
they didn't do that yet. So
Okay.
we were done with draping as far as that went.
Oh, you are. Okay.
Yeah, so if you want to
Yeah, come on up. Come on, Brenda.
Guys, come back again.
So, if Brenda's my patient, and she comes to the clinic just like this. She's wearing a shirt, she's wearing shorts, and we can't put her, I'm not going to put her in a hospital gown when she's in the clinic. Okay? So, let's say I'm going to do a treatment to her back. Okay? So, if you don't mind, on your side. So the first thing I do is I'll put a pillow, if you can push up, I'll put a pillow under their pelvis, okay? So if I want to get to her back, I want to expose this much area, okay? So there's a couple different ways to do it. One is you could just simply use a towel and you cover like this, okay? So I'm going to pull the shirt up at this point, okay? And if they have a bra, on, a lot of times I'm asking my patient, can I undo your bra? So I'll undo the bra, so that gives me now exposure to the back, okay? If they have a sports bra on, then what you could do is you could tuck it up and under like that, okay? But so that's to get here. But typically I'm exposing, again, this part here, so I want to get down to her low back. So I'm going to take the towel, tuck it underneath, okay? And then I'm going to pull, and I'm going to expose just the area that I need to get to, is right here. Now, if I'm doing ultrasound with gel, or if I'm doing a cold pack, if I'm doing massage, any kind of manual therapy with cream on me, I don't want to rub it and get it on her shirt. So I typically take another towel and I'll go up here. And so now, if I get gel here, it's okay. If I get cream on my hands on here, that's okay. When I finish my treatment, I'm taking some kind of cloth and I'm cleaning her skin. And then I'm making sure that I undrape her. And if I did undo the bra, obviously put it back. Refasten it. And I'm returning my patient to the exact position that I received them in. Okay? So that's if I'm doing the treatment here. If I'm working with her hip, say I need to do, say she has trochanteric bursitis. Okay? So now what I need to do is I need to position her in side line. So what I want you to do is I want you to roll onto this side. Face me. So here, I have a pillow for her head, so she can be comfortable here. I'm taking a pillow and I'm putting it between her legs. Okay? So again, now, here's my area. Okay? So there's two ways to get to this area, either from the bottom or from the top. And really how you get there depends on a couple things. The person's body shape, whether they have a large abdomen or not, whether they have a large thigh or not, and whether they feel more comfortable with you pulling up here, or whether you're pulling down there, okay? I prefer to gain access from here. So again, I'm covering up. I'm making sure that my towel is going to cover here. I'm coming in. So I'm going to really get up to that area, and if you don't really pay attention, I mean, you could expose that groin region, okay? So that's how you want to do that, or
What if they have pants on?
if they have pants on, they have to undo their pants. And that's a good question. Typically, if they have pants on and they don't want to take their pants off, I'm going to leave the room. And I'm going to say, you know, you're going to have to pull your pants down, put a pillow between your legs, take this blanket or towel, cover yourself up, and then call me when you're ready. So I'm letting them do that on their own. And you can do that in the outpatient or home health setting. But, you know, I'm not going to obviously take their pants off.
A lot of times though, once if you treated them once and they came in pants, if you just say next time if you can remember to bring shorts, it'll be easier. And they're like, oh, okay.
Yeah, and then they'll change into shorts, obviously. And so here, if I'm up here at the hip, then I'm going to go ahead and I want to make sure that I grab where I need to grab, pull down. So again, guys, I've reached the area, but I'm looking at different things here than I am down here. You guys see the difference? And again, it's totally whether the patient feels comfortable with me having like this or here or something that's getting in the way. And when you guys do in modalities, you'll do ultrasound. You'll do transfixion massage, you'll do soft tissue work, you'll do stretching, you'll apply ice packs, ice massage, you could do muscle stimulation where you put electrodes there, TENS.
A lot of times though in the outpatient you'll get people like this and what you want to do, they'll want a sheet over them, so you have to work to what their level is. So you'll have a sheet over them, but you still have to do your job. But they're like, I'm not comfortable with this even with the curtain closed. They're just modest people you're just gonna have there. So you You can put a sheet over them.
Yeah, and you can make it as tight as like that. I mean, you can cover it up so really just this region is exposed. Okay? Yeah, good point. And also, in the outpatient setting, you have table, table, table. Sometimes no curtains, so patient A can look at patient B, can look at patients. Everybody's kind of looking at each other. So draping is very important. Any questions on that? You guys want to practice that?
Sure.